Our bodies, our rights, our choice. I'm Dr. Thema Bryant-Davis, and as a womanist psychologist and liberation psychologist, I am calling on all psychologists to oppose Texas's new bill, Senate Bill 8, which seeks to diminish the health autonomy of women and all people with wombs. We recognize from our psychological science that barriers to health access, including reproductive rights, can increase anxiety, decrease self-esteem, and diminish life satisfaction. This bill decreases the time that people have to explore their reproductive rights. It also blocks one of our major protective factors, social support, weaponizing people against people. It also creates barriers to the work and the ethical responsibility of psychologists to create safe spaces for people to be able to discuss their health and well-being, including their reproductive rights. This law is a prime example of the necessity of liberation psychology, social justice-oriented psychology, and intersectional feminist psychology. All of these call for us to not only attend to the individual that may be distressed as a result of this law, but also to attend to these systems. When we look at physical and mental health disparities and analyze this legislation based on past laws, we know that this law will disproportionately affect impoverished women of color and impoverished people of color that are trans and non-binary. It is our ethical responsibility to allow our voices to be heard and to support our colleagues that are on the ground. We cannot be silent as women and other people with wombs are being objectified and their rights are being trampled. Together, as we mobilize and organize, we can thrive. Thank you.